Huff is the agency vice president of the Hilb Group, and he's with us here today to tell me about the Hilb Group. What is it that you do?
Well, first of all, Jane, thank you for having me. It's great to be here. I love your show. So the Hilb Group is a national top 25 insurance brokerage firm. We, under the leadership of Ricky Spiro, we specialize in commercial insurance, employee benefits, and HR consulting. We're located in Richmond, Virginia, our corporate headquarters. We have around 2,400 employees. And really, I think what's unique about the Hilb Group is we have all the carrier relationships and the resources that you would expect from a top insurance brokerage firm. But we really specialize in that boutique type service model and delivering, unique and specialized solutions to our clients.
And Purist Health, tell me about that and how does that fit into the Hilb Group?
Yeah, so I have a 20-year background in employee benefits. So Purist Health is our new proprietary level-funded healthcare plan. I'm super excited about this. Under collaboration with Health and Tech and Fusion, we've created a way for small and mid-sized employers to deliver a truly unique solution. Employee benefits outside of an employer's payroll cost is probably one of the most expensive things on their company's ledger sheet. So to be able to make an impact in that area to a small and mid-sized employer is really rewarding for me, and really excited about the collaboration and what we have for the future.
Tell me about your success with this collaboration. How's that working?
Yeah, so there's a tremendous amount of consolidation going on within the brokerage community right now. So specialization and creating unique solutions, I think, are super important. So, for example, at the Hilb Group, we've created a brand Telco Benefit Alliance. We do a lot of work within the telecommunication space. I partner with companies like River Street, Eric Kramer and his organization, and Dustin Durden at Pineland Telephone to really create a unique solution for healthcare for the telecommunication space. So I think as we move forward, delivering those specialized solutions is what's going to make the difference.
Are you against BUCA? And explain what BUCA is.
Yeah, great question. Absolutely not. So BUCA, the big commercial health insurance carriers like Blue Cross, United Healthcare, Aetna, and Cigna.
Okay, so that's where BUCA comes from.
Yeah. We have great relationships with those carriers. However, healthcare now is not a one-size-fits-all approach. So, for example, within Purist, our proprietary level-funded healthcare program, we've partnered with many of those commercial carriers as a key component of that program. But really, when the vision around Purist was, how do you pull the health insurance product apart and partner with best-in-class solutions to deliver a more affordable and customized solution to that small and mid-sized employer? Jane, one of the things I think is most important is to understand is larger employers have the resources and the flexibility to create some of these things on their own. What we're trying to do is bring that down to the very small employer so they have the same competitive advantage in that area as larger employers.
Sure. And then, so I guess self-funded health programs, is that the solution? Is that the future?
I think it's certainly a part of the solution. Since ACA happened in 2011, self-funded, level-funded has become much more popular. It is available now in a much smaller employer market size than historically. So I think it's certainly a key component. One of the most important things is we've got to give employers back control of their health plan. They've got to be able to find the right solution for their particular organization, and self-funded is one of the ways to do that.
Okay. Thank you so much, Chad.
All right.
Thanks. With me is Dustin Planthold, the Chief Growth Officer of Health and Tech, or PIT, I guess we'd call it too. So talk to me about what Health and Tech does, and you support brokers.
We do. Well, hey, it is great to see you again. To last time, this is amazing. I get to be here in studio. I'll live here, Jane. We do work with brokers. As you've been meeting my partners, Chad and David, you found that they have a responsibility to help these employers around the country provide solutions to help them solve some of the complex problems that are currently within the healthcare system. So they are our first line of defense to help bring solutions out to the employers, from 5 employees to 10,000.
So who's your target then? Audience, customer?
That's a great question. Our audience is that CFO that is looking for solutions to support their bottom line. And when you talk about benefits, you you hear and you know that it typically is the after payroll, the second biggest line item for companies. Our target are these employers that are candidly tired of being sick and tired, because if nothing changes, nothing will change. And that's why Tim Johnson founded Health and Tech, to be able to bring the power back to the employer, to Main Street, to give them the tools to be able to reduce their costs, reduce the friction, and ultimately to power up their health plan at the same time and to support their bottom line.
Right. So that is the bottom line, I guess. Help them bring their costs down, but keep the service of good quality.
Correct.
Because that's also important to people.
It does matter, because at that point you become the benchmark of excellence. And that is what HIT stands for. That we are out there to guide these employers, to help these brokers, so that this becomes generational. That the problems that we solve today will be able to continue and be sustainable. We're not a fly-by-night company. That isn't the plan of the way we designed our software, the do-it-yourself benefit system. It's to be able to give the employer the ability, through the broker, through the general agency that they work with, the ability to be able to build what they need. It is not a one-size-fits-all.
So explain how it works, like for a small business. Where do they go first, and then what happens?
So they have a couple options. Well, we would love to work with them directly. Many of them feel comfortable of working through their local advisor, their local broker, maybe in a fiduciary, depending upon the size of that company. So the employer would contact their broker, or they'd contact us, and their broker reaches out to us, and we're able to work with them on, what are you looking for? What are the real problems at hand here? What is the friction? Now, my uncle, Dr. Steve Planthold, a cardiologist, said that I don't save lives, I extend them. What we're looking to do is provide solutions to extend the lives of these individuals, these employees, in a way of quality, but not sacrificing that, because when you're dealing with bottom line, you're looking to reduce costs. We're looking to increase the benefits.
Okay.
So mainstream matters.
What is the future for health and tech?
I would tell you some of the best advice that I ever received from Damon John was to say, it's okay to say, I don't know. But we're here to learn. We're here to listen. There are many wise women like yourself and wise men who you've met that are telling us what they are hearing. And so what we're able to do is to continue to pivot. We have DIBS 3 coming out here in the next month and a half, a solution that will help even more employers to be faster. Through our technology, we're able to underwrite an employer in real time and under 10 minutes to provide them with a self-funded program that can match the kind that they're finding through the name the biggest retailer you purchase from online, to match the way that they're distributing their benefits, to be able to help the bottom line of companies around the world. So ultimately, while I don't know everything, I can tell you that what we're designing now will indeed have changed the world for the better.
Yeah. Well, and I think working hard and being flexible is kind of the key to running a good business. Like you kind of have to keep an eye on what's going on in the industry and pivot quickly, as you mentioned. So
blessed are the flexible, for you shall never be broken. And that is what health and tech is. You're flexible.
I love that. Thank you so much, Dustin. Great.
Thank you for joining us. Thank you again.